Well, umbilical cord blood was first discovered to have stem cell potential in the early 1900s, and people thought that it might be useful in some way, but there was a great confusion. It took nearly 50 years for people to understand what a fantastic opportunity umbilical cord blood is. In my belief, umbilical cord blood has a role not just for transplantation in regenerative medicine, it is also going to be extremely important to help develop new drugs for the future. My research team have been working on the umbilical cord tissue for many years because we believe that it is probably the richest source of untouched mesenchymal stem cells, which have the potential to form bone tissue, cartilage tissue, and even in our laboratory we have turned mesenchymal stem cells into hepatic liver tissue, nerve cells, and many other tissues. And we believe that if you're able to keep this tissue, you may be able to use it for many years for that child or for another child in the family. I believe that there are three pillars of healthcare for the future: new drugs, new surgery, and stem cell therapies, sometimes used alone and sometimes used in combination as something that we call regenerative medicine. I believe that regenerative medicine is going to become a standard, important therapy for the future. In fact, umbilical cord and cord blood are the most easily accessible tissues in the world, with 130 million children born every year, according to the World Health Organization. This is certainly a tissue that we must consider. I believe that we have to have a debate about different types of stem cell banking in general, and that we must have the idea that we should consider to keep stem cells not just for the people who donate them, but also for the public. We have to think to the future to have new types of cord blood banks that will be able to help both the public system and the families who are kind enough to donate them.